We're going to start this morning by hearing from Professor Francis Pope, who is the brains amongst us all, possibly, Chair of Atmospheric Science from the School of Geography, Earth and Environmental Sciences at the University of Birmingham. And a very warm welcome to you as I hand over to Dr. Francis Pope.
Thank you, Rachel. Hello all, so it's a pleasure to be here. Thank you very much for the invite. So as introduced, Francis Pope. I'm a Professor of Atmospheric Science at the University of Birmingham, and I've been tasked with giving you just a snapshot of the science behind air pollution at the moment. So next slide, please. So when I talk about air pollution today, what I'm going to be talking about is particulate matter air pollution. So particulate matter, as the name sounds like, are these little particles in the air that we breathe in every day. So to give you a sense of the size we're interested in, the human hair is about 70 microns across. And the size that we're interested in is anything lower than 10 microns inside. So 1/7 of the size of the human hair. And what tends to happen is as these little particles get smaller and smaller, they get worse and worse for our health. So we tend to break them up into two size ranges. In particular, there's PM10, which is this less than 10 microns, so 1/7 of your hair. And then there's PM2.5, which is the finer stuff, which is about 1/30th of the size of your human hair. And it's the smaller stuff that tends to be worse for us. And it's also the smaller stuff that tends to come from human activities. So that just gives you a sense of what we're looking for. And all the compositions are different in here. So can we go to the next slide, please? So this image shows you where these different sizes of particle get to in our body. So of course, our first interaction with them is as we breathe them in. So the first size we're interested in, this particles which are about PM10, so that's the 1/7 the size of our hair, that gets into our upper respiratory tract and stops there. Then the finer stuff, which gets further down into our lungs, so that's the PM2.5, that gets into our lungs. And so that starts interacting in there. And then when we get smaller and smaller, it gets further and further into our lungs. And when we get to the really small stuff, then that can start getting into our bloodstream. And there's a lot of research around at the moment showing how these particles can interact with all the organs in the body. They can pass all through the body. They can even get up to our brain. So there's a growing body of work which is really showing that not only does this particulate matter affect our physical health, it can also start to affect our cognitive health, our mental health. And what we should think about is in terms of our daily lives, this ability of the PM to affect our health, to affect our cognition, that affects how our children can study, that affects how we can do our work. So we're very much a high-tech country at the moment, so our ability to think is probably more important than our ability to lift things up nowadays. So this link to cognition, I think, is very important and will become only more important as we go through. Next slide, please. So I was asked by the team just to give a very brief snapshot of some of my research. So my research really goes all the way from the micro to the city scale. So, so what I thought I would do is I'd give two examples. So the first example is really looking at a single piece of particulate matter. So what we have here on the right-hand side is some very complicated equipment at the Central Laser Facility at the Rutherford Appleton Labs in Oxford. And this is work I've done with Andy Ward. So here what we're doing is we're levitating, trapping a single particle, and we can see it, that's the green dot at the center of your screen. And so we can do very precise measurements on single particles. We can understand how the physics change, how the chemistry change, how the biology changes. So from that very precise measurements, we go all the way up to the city scale. So if we go to the next slide, please. So this is some work I've been doing recently with an artist called Robin Price. And so what he does is he images the air pollution in cities using long exposure photography. And so I've picked out 3 of his images here from 3 different countries. So one is in Ethiopia, one is in India, and one is in the UK. And so the density of the dots, the number of dots, that gives you an indication of how much air pollution is. And one of the troubles with air pollution is it's largely invisible. So the idea behind this work was to try and make the invisible visible. So on the left, first of all, we have Ethiopia, and it's actually relatively clean there, below WHO guidelines. In the middle, we've got a picture from Port Talbot in Wales. So this is near the steelworks. And so this is just slightly over WHO guidelines. And this maybe shows you the tension between industry and clean air and air pollution. And on the right, we have a picture from Delhi, actually in a children's playground. And this is unfortunately one of the most polluted cities in the world at the moment. So we're about at least 30 times over WHO guidelines. But again, this shows us looking at the city scale. So going from that micro to city scale. Can I have the next slide, please? So something that my group is very interested in, very keen to make sure that people understand is how do we define vulnerability to air pollution? So I think there's three lenses to look at this through. There's the exposure, so how much air pollution is there and how does that vary through the city? And this nice work by DPD we'll hear from today will tell us about that. Also, we need to think about susceptibility. We need to think who is affected particularly by air pollution. So it turns out the young are affected, the older are affected, and those with pre-existing conditions are affected. And finally, and just as importantly, we need to think about the adaptive capacity. And put simply, how able are we to engineer ourselves out of the problem? How able are we to pay ourselves out of the problem? So can we afford to have air conditioning in the house? Can we afford to have air conditioning in our cars? Can we afford a face mask, etc.? So I think it's important to remember this and how all these three things vary throughout our cities. So just the final slide now, please. So just about this work, I think it's really exciting. So typically what we've got to look at air pollution in the UK is fixed sites. And so we've got a very nice fixed site network in the UK. So on the left, this is where the fixed sites, these measure air pollution, very high quality. And there's about 170 of these in the UK. But that means we've only got one site per 400,000 people. And depending where you are, there's very little information. So even if we look at London in the middle picture, what we can see, the sites are indicated by the green bubbles. And what you can see, depending where you are in London, you can have very little information. And so this is why I think this work by DPT, is really, really useful. So what they're doing is measuring the spatial variability of air pollution, and we can start to see where the hot spots are and how people interact with them. Again, going back to that previous figure of how does exposure interact with susceptibility, interact with adaptive capacity. And with that, I'd like to end. Thank you.
Francis, thank you so much. I think the illustrations that you have shown us there are quite horrifying if you've never seen anything like that before. And I do wonder, and this sounds like a kind of slightly trite question, but because we're talking about such tiny, tiny things, is it just difficult, do you think, for people outside your realm of expertise to get their head around the damage that can be done by something so small?
Yeah, absolutely. I think so. This invisibility problem is a big problem. It's very easy to forget about it if you can't see it. I think the other problem is people tend to feel quite helpless about it. So what can I do which will actually make a difference? You need everyone to reduce their polluting behavior to really make a difference. So to my mind, they're the two things that we need to make the problem more visible, whether that's via art, science, crossovers, etc. But we also need to give people good tips and hints on how they can make the air pollution in their local vicinity better. So to give them agency to help them make a difference.
I mentioned Rosamond Kissy Deborah, who is listening along to this, and she raises a really important question. I'm sure you know her. She says, "Hi, Dr. Pope, can the damage caused by ultrafine particles ever be reversed?"
That's a really good question. So certainly we know that the effects of air pollution are chronic. So the more our lifetime exposure to it, the worse the effects will likely be. And there's a growing body of evidence to show that acute, as in short-term effects of air pollution can have a big effect as well. I mean, I wouldn't like to say definitively, but I think both sides are important. So certainly it's if you're exposed to high pollution, that's not the end of the story. If you improve your situation, you can make your life, your health better. So I think, yes, so certainly you do have agency in that respect.
There are so many questions coming through here. Let me bring you this one. Do you have any insights on when governments start measuring ultrafine particles and will start regulating their emissions?
I guess there's not a definite date, but there's a clear move. The understanding that it is the ultrafines which are the most important. It is very obvious now, and we're expecting further guidelines from the World Health Organization soon. I don't know exactly when that's going to be released, but it will be soon, I am told.
And a great question here from Caitlin, who says, "Thank you, Dr. Pope. Would you recommend people continue to wear masks after the pandemic to help protect against air pollution, especially in cities like London?
That's a really good question. I'm not a huge fan of the mask myself in terms of just, my daily life. But I think, if you commute next to a particularly busy road, if you cycle next to a particularly busy road, then clearly you can filter out some of the majority of it. So I think, it's obviously it's a personal choice. And I think for certain situations, it could help. I'd prefer to see pollution go down rather than us putting engineering
dealing with the fundamental cause rather than the outcomes, for sure.
Absolutely.
These really interesting areas of discussion, and there are loads of questions that have come through. So I'm delighted, Francis, that you're going to be with us throughout the course of the morning, and we'll come back to some of those during the panel discussion later. Thank you so much for the time being, Dr. Francis Pope.